Very much. Thank you to you, Erica and Julia and Rizka for organising today. Welcome everybody, and welcome to Regina. Thank you so much for being willing to speak to us today. Regina is going to talk on the topic of global surveillance amongst young people. And I think this is a really interesting and important topic because to have national estimates of prevalence of physical activity is not only a difficult thing, but it's hugely important if we're going to keep physical activity on the policy agenda, both at the national and international level. Regina has been involved in surveillance of physical activity and other non-communicable disease risk factors for over 10 years. And her publication list is a very good sort of key reading list for anyone in this topic area on physical activity surveillance. I've been so lucky to work with Regina, particularly in the last year, and have got to experience her huge knowledge of the sort of global surveys that WHO run. So I'm really excited to hand over to her now and hear what she has to say, and we'll get some time for questions at the end. Over to you, Regina.
Thank you so much, Erica and Tessa, for the nice introduction. So let me share my screen and start with the presentation. Tessa, can you see my screen in full like normal mode?
Yeah, that's all good.
Okay, great. So thanks so much for the opportunity to present today on global surveillance of young people's physical activity. This is a brief outline of my presentation. I'll be talking about the health effects of physical activity and also of sedentary behavior for young people. I'll be talking about the WHO guidelines on physical activity and sedentary behavior and the different components of those guidelines, on how these guidelines are monitored, on whether young people meet these guidelines, and I will be finishing by talking about the Global Action Plan on Physical Activity 2018 to 2030 that presents actions to increase young people's physical activity. The health effects of physical activity and those of sedentary behavior for young people are well known. There is a big body of evidence on the health effects of these things. So enough physical activity improves physical fitness. It also improves cardiometabolic health. And this includes, for example, markers in the blood, such as lipids in the blood or blood sugar. Enough physical activity also improves bone health and also cognitive outcomes, such as memory, or young people that are active are better learners. Enough physical activity, on the other hand, reduces depression and also adiposity, which is a different word for overweight or obesity. On the other hand, the evidence also shows that too much sitting negatively impacts physical fitness. It negatively impacts cardiometabolic health and these markers in the blood. It negatively impacts overweight and obesity. Too much sitting has a negative impact on sleep duration among young people and also on behavioral conduct and pro-social behavior. The WHO guidelines on physical activity and sedentary behavior are based on this body of evidence. They came first out in 2010 and have been updated in 2020. So the update was relatively recent. They were launched the end of last year. And these guidelines include recommendations for different population groups, one of them being children and adolescents aged 5 to 17 years. Other groups are adults, older adults, and there are also recommendations for population subgroups, such as children and adolescents living with a disability. Now, these guidelines have different components for children and adolescents. One component is around moderate to vigorous intensity physical activity. The body of evidence led to WHO making the recommendation that young people aged 5 to 17 years should do at least 60 minutes a day of moderate to vigorous intensity physical activity across the week, with most of this activity being aerobic. Across the week means they do not have to do exactly an hour or more every single day. They have to accumulate 7 hours a week, so on average an hour per day. This type of activity, moderate to vigorous intensity physical activity, really includes any type of activity, such as you can see on the pictures: active play, cycling to school, physical education class. Anything counts, and it does not have to be 1 hour in a go. It could be 30 minutes here, 30 minutes there, two hours there. As long as this adds up to 7 hours per week, that would be enough. Now, this component specifically, this 1 hour a day on average, how is this monitored? It's monitored in different ways, but really the most two important surveys that monitor this internationally, and here I'm talking about the international level, are the GSHS and the hpsc. The GSHS is the Global School-Based Student Health Survey. That's a school-based survey carried out in the population of 13 to 17-year-old adolescents. That's done around the world, but mostly focusing on regions other than North America and Europe, because that's the hpsc. It's a very similar survey, just that the geographical coverage is different. So the hpsc focuses on North America and Europe, and the GSHS basically on the rest of the world. Otherwise, these are similar surveys, both school-based, both looking at the adolescent population, and both actually multi-risk factor surveys. They don't only look at physical activity. They look at multiple risk and protective factors for NCDs and other diseases. So there is a module on physical activity, there is modules on tobacco, alcohol, drug use, protective factors, and so on. Anyways, these have been administered widely. For example, the GSHS, there is more than 100 countries that have done a GSHS over the past 2 decades. To give you an idea of how this specific aspect of the guidelines is assessed then, so the GSHS has one specific question on that, and I'll read it out because it's a little bit small. There is some introductory text that lists examples of what is meant by physical activity, such as running, fast walking, biking, dancing, football, and other examples that countries can insert. But the actual question is, during the past 7 days, on how many days were you physically active for a total of at least 60 minutes per day? And as I said, this is administered at school. It is self-administered by the students. They fill the survey questionnaire during a classroom period. And they're supposed to add up all the time they spend in any kind of physical activity. So do they do 60 minutes per day? On how many days? They're supposed to answer how many days. The question in the hpsc, the survey that covers North America and Europe, is very similar. You can see there, over the past 7 days, on how many days were you physically active for a total of at least 60 minutes per day? And they're supposed to give an answer between 0 and 7 days. This is how this is mostly assessed around the world. And of course, there are some countries that have other national surveys with similar questions. But these two, the GSHS and the hpsc, are the biggest ones. The 2 links to these surveys are at the slide as well. Do young people meet this aspect of the guidelines? do young people do on average 60 minutes a day of physical activity? Now, this chart is on the percentage or the prevalence of not doing this. So this is the percentage of not meeting the guidelines among school-going adolescents aged 11 to 17 years. And this chart shows 2 different years, 2001 and 2016. It's pooled data from 146 countries. So as I said, this represents the prevalence of not meeting the guidelines. The different bars are for the different adolescent populations. Blue is males, red is females, dark blue is 2001, dark red 2001, brighter colors are 2016. Each group of bars represents different groups of countries. The 4 bars at the very left are the global bars. And you can see on the axis, they go up all the way to around 80%, indicating that about 80% of adolescents aged 11 to 17 years, looking across data from 146 countries, do not meet the physical activity guidelines of 60 minutes a day. You can see the prevalence is high across the different income groups. So after the 4 bars for global, it goes 4 bars for low income group, lower middle income, upper middle income, high income group. There is not much variation, not any income group where we really see a big difference in prevalence. They're all around 80%. We see a tendency of boys being slightly more active than girls. We see a tendency of boys showing some small improvement since 2001, but not much. And in girls, we don't see any improvement. So the situation regarding the prevalence of physical activity or the prevalence of inactivity has not improved really since 2001. Now, there are other aspects to these physical activity guidelines. The aspect I've just presented, this component of doing 60 minutes a day, that's the one where there is the biggest body of evidence behind. But the evidence also shows that children and adolescents should incorporate vigorous physical activity on at least 3 days a week. So let's look at this aspect. Vigorous intensity physical activity means that this is at an intensity where really they start to sweat and breathe hard. This should be done on at least 3 days a week. And examples you can see on the pictures would include running, playing soccer, playing basketball, and so on. Now, how is this aspect assessed? This aspect of doing vigorous intensity physical activity 3 times a week. There is no question on this in the GSHS. The hpsc has one question that reads, on outside of school hours, how often do you usually exercise in your free time so much that you get out of breath or sweat? And then there are a number of answer options, times per week. So as I said, vigorous intensity activity is less frequently assessed in international and national surveys as compared to the aspect we've already seen, moderate to vigorous intensity physical activity. And the questions are less standardized. There are countries that have questions around vigorous intensity activity in their national surveys, but they're not standardized. Let's look at some of the data the hpsc has produced. And this is a slightly more complicated graph, so I'll spend some time on explaining it. So this is data from the hpsc. Remember, that's the survey done in North America and Europe on a regular basis. They have different waves. This is on the wave 2017-2018, and you can see all the countries listed there. Again, as before, red is girls and blue is boys. This specifically is for 11, 13, and 15-year-olds, and it shows the prevalence of doing vigorous physical activity on 4 or more times per week. So on the x-axis, this goes from 0% to 100%, and you can see the average represented by this slim black line is just over 40%, meaning 40% of adolescents across these countries do vigorous physical activity on 4 or more times a week. Now you see these different bubbles. The bubbles with that have sort of a hole that are not full. These are the bubbles that represent the poorer families, if you like, because this is a graph, or this is an analysis that looked at things by family affluence. So the bubbles that are not full represent the poorer families, and the bubbles that are full represent the richer families. And you can see, for example, Sweden, girls from the poorer families have a prevalence of about 15% of those doing vigorous physical activity 4 or more times a week, whereas the girls from the richer families have a prevalence of 47%. So they engage much more in vigorous physical activity. And it's a similar picture in boys. And it's similar across all the countries listed. And this is just a snapshot, but it keeps going down, and it's the same picture. People from poorer families tend to engage in vigorous physical activity less than those from richer families. You can also see across the board, for all of the countries, girls tend to do this vigorous physical activity less so than boys. To note that these reported data here don't quite match the guidelines. This here is about 4 or more times per week of vigorous physical activity versus 3 or more times in the guidelines. For more information, you can go to the hpsc report. Now, in this same component of the guidelines, there is another aspect. There is an aspect of muscle strengthening. Young people should also incorporate on 3 days per week activities that strengthen muscle and bone. So really, that's a third component of the guidelines. This would be activities, as you can see on the pictures. Climbing, for example, would also be, for example, gym. How is this aspect assessed, the muscle strengthening? Now, there is one question in the GSHS on this aspect. During the past 7 days, on how many days did you do exercises to strengthen or tone your muscles, such as push-ups, sit-ups, or weightlifting? Could also be climbing and so on. 0 to 7 days. This is a new question in the GSHS. It hasn't been used much. It has been moved from the expanded list of questions, like questions that are optional for inclusion, to now the core list of questions. So hopefully in the future, this will get used more, but in the past, it hasn't been used much. There is nothing on muscle strengthening in the hpsc, and there is generally very little data availability on this aspect of the guidelines. So the global data availability here on muscle strengthening exercises among young people is extremely weak. I've had a bit of a look around to see what's out there just from countries. Since we don't have any international data, there is really not much. I have done non-systematic search, but for the United States, for example, CDC Healthy Schools, there is a statement that in 2017, just over 50% of high school students participated in muscle strengthening exercises on 3 or more days during the previous week. So there is some information in the United States. For the United Kingdom, I came across a paper written by Strain and others. that actually says regarding child muscle strengthening activities, this is currently not measured in any national survey in the UK. And that is the case for many countries around the world. Information on this aspect is just not available. There is one more aspect to the guidelines regarding children and adolescents, and actually regarding all population groups. Every move counts. It's not that they either meet the guidelines or not, but even if they go from doing nothing to doing a little bit, there is a health benefit. So doing some physical activity is better than none. And that is true for all population groups. Now let's look at the final aspect of the guidelines around sitting. The guidelines also recommend to limit the amount of time spent being sedentary, particularly recreational screen time. Of note that there is currently no threshold defined due to limited evidence on how much sitting is too much for young people. So all that can be said based on the evidence now is to limit the time sitting, but we don't quite know yet where should be the cutoff. Now, how is this aspect assessed? There are questions around sitting time or specific aspects of this in these two international surveys, the GSHS and the hpsc. So the question in the GSHS, that's the survey done in regions other than North America and Europe. It asks students, how much time do you spend during a typical or usual day sitting or watching TV, playing computer games, talking with friends, using your mobile phone, or doing other sitting activities, and countries can add more examples. So this one in a way combines different types of sitting activities outside of school and doing homework. The hpsc, the survey, the school survey that's done in Europe and North America, has more specific questions on specific types of sitting. One is around watching TV and videos. So how many hours a day in your free time do you usually spend watching TVs, videos, DVDs, and other entertainment on screen? And this is separated out for weekdays versus weekend because these behaviors might vary quite a bit between weekdays and weekend. There is another question around playing games on a computer. So how many hours a day in your free time do you usually spend playing games on a computer, games console, tablet, and so on? And another question that reads, how many hours a day in your free time do you usually spend using electronic devices such as computers, tablets, or smartphones for other purposes? For example, homework, emailing, tweeting, Facebook, chatting, surfing the internet. So in the hpsc, there are a couple of questions around these specific types of sitting and using electronic devices. But there is currently no international harmonized question, if you like, that would assess sitting time. Let's look at some data. This is from the GSHS. From the question I've just presented, this chart presents the percentage of young people aged 13 to 15 years, school-going people, that sit for 3 or more hours in their free time. And this is just selected countries, random countries that I've put together that have done the survey in different years. Again, blue is males, red is females. And on the y-axis, you see the percentage of those sitting 3 or more hours in their free time. And you can see a huge range across countries. It goes from as low as 10% in Nepal in 2015 up to over 60%, for example, in Kuwait in 2015. in girls in the United Arab Emirates in 2016, you see pretty much almost across the board that girls sit slightly more as compared to boys, not in all countries, but in most, in their free time for 3 hours. But again, you see a very wide range in prevalence across countries. As I mentioned on the previous slide, time spent sitting at school or for homework is not considered in this question. And again, there is no exact match with the guidelines because the guidelines do not specify a threshold, as I said earlier. Now, these were the different components, if you like, of the WHO guidelines on physical activity and sedentary behavior and how they're usually assessed. And I've presented some data, but I also wanted to mention that there is another way of actually assessing physical activity in young people, and that is through objective measurement. Physical activity can also be measured objectively, and that means using actual devices that capture movement. They're called accelerometers. They can be worn on the wrist, like here in the example. They can also be worn on the hip, for example. There are different devices out there. They all measure movement, acceleration, which allows them to actually track physical activity at different intensities. These devices, they can measure if an activity is of vigorous intensity or moderate intensity. They can also measure sitting behavior and sleep. They need to be worn over a couple of days, generally a week. So this is, of course, more difficult to implement as compared to administering a questionnaire. But several countries, although they're mostly high-income countries, have measured physical activity objectively among young people at a national level. Examples are Canada, the US, Norway. They have conducted surveys at a national level where they've put these devices on a random sample of young people for about a week. So young people have worn these devices for about a week and the data got analyzed. But objective physical activity data globally are still relatively weak, the availability of it. It's still mostly high-income countries, though there is quite a bit of research now going on in lower and middle-income countries, including research conducted by WHO, looking at the feasibility of wearing these devices in lower-income countries as well. Now, we've seen the levels of physical activity among young people. We've seen that actually lots of young people do currently not meet the physical activity guidelines that would give them a health benefit. So now let's look at what can actually be done to increase physical activity levels among young people. Member states of WHO have requested WHO to develop an action plan on physical activity. So this was done, a global action plan on physical activity 2018 to 2030 has been developed by WHO. It's referred to as the GAPA. This was developed through a worldwide consultation process involving governments and stakeholders from many sectors. The plan has a vision. The vision is more active people for a healthier world. The plan is for all age groups, but there are specific actions outlined for young people. The target in this plan is a 15% relative reduction in the global prevalence of physical inactivity in adults and adolescents by 2030. This action plan has 4 objectives. And each objective includes a number of policy actions that can be done to increase the levels in populations of physical activity. In total, it's 20 policy actions. And I'll be talking about some of the actions specifically for young people per objective. So in the next couple of slides, I will go into each objective. Objective 1 in the GAPA is to create active societies. I've put the objective as it reads in the plan fully on the slide, just for reference. But here, in simpler words, I've put what this means in terms of young people. So really creating active societies, the first objective of the GAPA, means to increase young people's knowledge around the benefits of physical activity. This is linked to this one objective in the GAPA. Examples for actual actions include proper training for teachers to understand the value of promoting physical activity, so that then they can transfer this value to their students, or engaging young people in organization of regular free mass participation physical activity initiatives. And you see some pictures there. These are just 2 examples that I've pulled out of the GAPA to mention them here, but there are many more in the actual action plan. Objective 2 in the GAPA is to create active environments. And again, you have the full objective there, but in terms of young people, this means to create environments for young people that make it easy to be active. Examples for action could be to create the space for safe walking and cycling to school. We know this is often not the case. Oftentimes, in low-income countries or in countries of all income groups, there is so much traffic. It's just not safe to ride a bike or to walk to school. So a specific action to help increase young people's physical activity would be to create the space for safe walking and cycling to school. Another example is to improve the provision of public open space that young people can use to be active. The third objective is to create active people. For young people, it really means to create plenty of opportunities for young people to be active. An example would be to strengthen the provision of good quality physical education, and also more positive experiences and opportunities for active recreation, sports, and play. There is so much diversity in the interest of young people regarding physical activity. Some are interested in say, football, others are interested in gymnastics, or others are interested in just playing actively. It's important to create opportunities for all of these different interests for young people to be active. And lastly, the fourth objective is to create active systems. And this really brings it all together. It means creating an entire system that makes it easy at all levels for young people to be active. An example could be for the education and health sectors to work together and co-lead the implementation of health or physical activity promoting schools. This objective here kind of means it's not enough to work at one level. For example, it's not enough to increase the knowledge about the benefits of physical activity in young people. That's not enough. It could be they know that physical activity is good for their health, but there are no opportunities out there for them to actually practice physical activity, and the environment is very not productive for them to actually be physically active. So that means this is not enough to work at that one individual level, for example. Countries, societies, governments, communities need to work at all levels in order to increase young people's physical activity levels. Many more specific actions for different stakeholders are in the Appendix 2 of the GAPA. There are lots of actions listed, and they're grouped under the 4 objectives I've just presented. Collectively, these actions form a whole system approach to increasing physical activity opportunities. There is also another document produced by WHO. It's called Active, and it's a technical package for increasing physical activity that provides guidance on actually how to implement these actions, how to implement this whole systems approach. And WHO supports countries with the implementation. This is a summary of my presentation. We've seen that few young people meet the guidelines on 60+ minutes of moderate to vigorous physical activity daily. In fact, it's only 1 in 5 adolescents that meet these guidelines. Only 20%, the other 80% do not meet the guidelines. We have also seen that there is a need for more and better data on other aspects of the guidelines, including on vigorous intensity activities, on muscle and bone strengthening activities, and on sitting time. More and better data will be very important for targeted action. The more detailed the data are for the different subgroups of young people, the better the actions can be targeted. The GAPA offers a menu of actions to promote physical activity, and Active provides guidance on how to implement these actions. And with this, I would like to thank you all very much for listening to me and for your participation in this webinar. Thanks a lot.